Hey everyone, welcome back to Strategy Saturday. So Anne here, your nurse and your transformational coach. Welcome back here. We're going to talk today about excessive workload and how it can contribute to the higher risk for the patient and how probably obviously it's contributing to our stress and our burnout and all those feelings of overwhelm. We're all feeling that increased workload. We're trying to do more with less, staffing issues, sicker patients. Sometimes it feels like maybe we just throw some meds at some patients and move on, right? Just trying to keep our heads above water. We can, of course, use some of the tips and tools that we've been learning along the way with our Strategy Saturdays, flip that coin, that perspective. And yes, I do think there is some unrealistic expectations and a whole lot of pressure that's on us. And the workload has definitely increased. And most of us have found, we've been in the profession for probably 10 plus years, the patients are definitely coming in sicker than they used to. But the one thing we can control is how we respond to all that, right? So we need to focus on what's right in front of us, focus on that patient, maybe how we can connect with them, even if it is only for a few minutes. So some of the information today comes from an article by Joe Stevenson. It's about how workload can really lead to poor patient outcomes. It's something we've all probably seen firsthand. Study that came from Finland, but how much that can contribute, the workload can contribute to patient safety. They found that if your workload is above optimal, quote unquote optimal, we'll have to figure out what that really means, but 30%, if it's up to 30% above optimal, the odds of a patient dying increased by 40%. That's quite a big jump. But they also found that, the opposite, that if your workload dropped and you had more time to observe and care for your patients, that the risk of incidents and deaths was about 25% lower. So there is actual research out there that shows kind of what we know already, right? It also adds to evidence the link between staffing levels and patient welfare, right? We kind of got to look at that on a daily basis too. I mean, obviously sometimes the patients aren't quite as complex and some days are better than others. So many studies have showed that insufficient nurse staffing in hospital has that negative impact on welfare. And they also argue that there's an inconsistency between the link of staffing and mortality and those outcomes. So it's not always as clear cut, but there's definitely that association. They also say that the risk of patient safety incidents whenever workloads above optimal increased by 8 to 32%, depending on the incidents. And as we said, the mortality increased by 43 if it exceeds the preferred level, quite a bit. So reduced workload would mean that nurses have more time for caring for your patient, right? Observing each patient, which may reduce the risk for those adverse events. We'll hopefully catch them sooner, right? When things start to deteriorate, we can actually do something about it. And always use your code buttons, right? Ask for help. And as part of the study, they also found evidence that more traditional methods of determining staffing levels using nurse to patient ratios may be less robust than basing staffing on kind of patient acuity. So maybe that's a change in our culture too, right? We need to actually figure out how sick these patients are and staff according to that, not just patients in beds. They also said that sometimes it's a lack of knowledge, stress or burnout, and that we're working in these hard pressed environments that kind of leads to some issues too. So pretty much they're saying that higher nursing workload is associated with worse outcomes. That's kind of the standard here. So high nurse workloads are correlated to higher infection rates, higher incidence of readmission, more patient falls. We probably all know that one. Can't get in there to everybody that needs to go to the bathroom at the same time when everyone wakes up in the morning. Longer patient stays, diminished ability of nurses to actually assess and observe potential complications in their patients, and of course probably some lower patient satisfaction as well, right? They just don't have time to kind of spend with these patients. And we as nurses, of course, are having the adverse effects as well. So, they found that each additional patient assigned to a nurse led to a 23% increase in the risk of burnout. 23, that's quite a bit. That's just one patient. And 15% increase in job dissatisfaction. So, and part of that is the frustration of all that can lead to us not taking care of our patients, right? We're just too much and not enough time. But once again, how can we kind of fix that problem, right? So they kind of are suggesting, following California's minimum nurse to patient staff ratios, that, less deaths, higher levels of job satisfaction. So we all need to work together. That's kind of the bottom line with that. Whatever we have and whatever we're dealing with, we all just need to be in it together. Teamwork, right? No matter the staffing, the workload, it's about the patient still. The end, that's the part we need to actually take care of the patients. Of course, we're still taking care of our self. So take that time you need to refresh and refuel, keep that positive perspective, be that positive influence at work. I know that there is some actual science research behind some of our workload issues. Remember that I'm here helping professionals with overwhelming challenges and burnout to build your resilience and take ownership of your well-being. Thanks for joining me this week, where we Strategy Saturday, where we explore how to navigate the challenges of nurses. Comment below if you're feeling the stressors of the workload or if you need some support. And of course, if you need it, seek out that professional help as well. And also remember that I'm coming live to you Monday, September 20th at 10:15. So it's an upcoming announcement about a challenge I'm super excited to bring to everybody. The challenge, mark your calendars, it's going to be September 29th to October 2nd. So hopefully everyone will join me Monday, and have a great weekend, and I'll see you then.